So if you're dealing with sciatica from a herniated disc, you know the real fight isn't just with the pain, it's with the calendar. Today, we are going to break down one of the most critical decisions you'll ever face, what the 6 versus 12-week window really means for your recovery. Man, this quote just nails it, doesn't it? It perfectly captures that unique frustration of sciatica. It's that feeling of just watching the weeks tick by, and you're not just losing momentum, you're losing your sense of control. You feel trapped, not just by your body, but by time itself. Because let's be real, every single day you're dealing with this, your world gets a little bit smaller. You know what I'm talking about? It's the missed days at work, the nights you can't sleep, the parties you have to say no to. It's this quiet, slow motion shrinking of the life you actually want to be living. We're going to talk about how to get that back. And that brings us to the big idea here. We're going to completely reframe this whole waiting period. This is not about passively sitting around and just hoping things get better. Nope. It's about turning that time into an active, strategic project with really clear goals and checkpoints. Let's be honest, this is what most of us do by default, right? We do a couple of stretches we found online, maybe we pop a pill here and there, and then we spend hours scrolling through forums, just hoping for some kind of magic bullet. But this hope and scroll waiting, it has a huge hidden cost in lost sleep, lost confidence, and just lost quality of life. Okay, so let's get on the same page about what we're actually talking about here. Sciatica from a herniated disc. It's that very specific leg-dominant nerve pain, the kind that feels burning or electric. And it's happening because a damaged disc in your lower back is either physically pushing on a nerve or, just as often, it's leaking inflammatory stuff that's ticking that nerve off. Knowing that is key to the whole strategy. All right, so this is where it all comes together, the two timelines. Now, the 6 and 12-week marks, they are not deadlines. Don't think of them like that. Think of them more like signposts on a map. They're designed to help you and your doctor make smart, informed decisions instead of just, guessing. Now, these two timelines, they have totally different jobs. The 6-week mark is your first big checkpoint. And the goal here isn't to be 100% pain-free. The goal is to have proof that you're actually getting better, not just treading water. The 12-week mark? That's for when you're on a structured plan that you know is working. It just needs more time. See? 2 different tools for 2 very different situations. So how do we actually do this? How do we put it into action? We do it by making our wait smart. Now, a smart wait is the total opposite of passive waiting. It means you're actively tracking your progress, you're following a structured plan, and you know exactly what your next move is. This is how you turn all that anxiety into action. So what does good waiting actually look like? Well, it boils down to 3 simple steps. First, and this is a big one, track your function, not just your pain score. How many minutes can you walk today? How many good nights of sleep did you get this week? Second, you got to work with your doctor on a clear medication plan to protect that sleep and movement. And third, you have to schedule progress checks. Don't just let weeks drift by without a real review. So, when you're in the smart wait period, what are you actually doing? Well, you're trying things that can really move the needle. We're talking about targeted physical therapy that's guided by your symptoms, not some no pain, no gain nonsense. It could be a specific medication strategy, or maybe even image-guided injections to knock down that inflammation. The key to all of these is that they are measured and they are time-boxed. Oh man, I absolutely love this quote because it is so real. This is what a functional win looks like. It's not about running a marathon. It's about getting one small, normal piece of your life back. And when you start tracking and celebrating these little victories, you build momentum and you prove to yourself that your plan is actually working. Okay, now we need to get serious for a second. We need to talk about the exceptions, because there are times when waiting is absolutely the wrong move. This is when you stop debating timelines and you get urgent medical care. Okay, I need you to really listen up because this is crucial. These are the red flags that override everything else we've talked about. If you experience progressive weakness in your leg, meaning it's getting worse, any changes in your bladder or bowel control, or any numbness in your groin or that saddle area, you stop waiting. This is not a wait-and-see situation. It requires immediate medical evaluation. All right, let's make this super practical. Think of this as your personal decision card. On one side, you've got the 6-week escalation. You choose this if your function is flatlining, your sleep is still awful, and you're actually getting weaker. On the other side, you stick with the 12-week structured plan, if and only if you can measure small, consistent improvements. See the difference? Remember the golden rule: your trend line decides your timeline. All right, this next piece is, for me, maybe the most important part. It's all about taking back your power. We're going to completely shift how you talk to your doctor. You're going to stop being just a patient describing pain, and you're going to become a calm operator who presents data. I promise you, this one shift can totally change the outcome of your appointments. We've all been there, right? You finally get to the doctor, and you just say, it hurts a lot. And look, it's honest, it's true, but from a doctor's point of view, it's not very actionable. It describes a feeling, but it doesn't really describe a problem they can build a specific plan around. Now, listen to this. This is the game changer. What a difference. This statement has data. It gives your doctor measurable facts to work with. Walking tolerance is down to 10 minutes. Sleep disruption is happening 3 nights a week. This isn't just a complaint, it's a progress report. It immediately changes the entire conversation from sympathy to strategy. And that's really the secret sauce here, isn't it? When you track these simple numbers, you are no longer just telling a story of frustration. You're presenting a case study with you as the subject. You are giving your own experience the weight and the credibility it absolutely deserves, and that helps you and your doctor build a much, much better plan. So, we've gone through a lot. The timelines, the red flags, how to become that calm operator. Let's make this real. What is the single smartest step you can take in the next 15 minutes to put all this into practice? So, if you're going to remember anything from our chat today, let it be these 4 things. 1. Measure your function every week: walking, sitting, sleep. 2. Use that 6-week mark as a brutally honest checkpoint. Are you getting better or not? 3. Only commit to a 12-week wait if you're on a structured plan with clear goals. And finally, say it with me: your trend line decides your timeline. In the end, it all boils down to this one question. The choice isn't between being brave or giving in. The real choice is between random, passive waiting, where you just hope for the best, or an active, strategic recovery where you take control. So, which one are you going to choose?